I'm Monica Salvia. I am the Associate Director of Alumni Engagement at Penn Nursing. I've been there a number of years, which I sort of got to go down memory lane a little bit with some of our panelists for how long I've been involved and working with various folks here. But I'm just thrilled to be here tonight. I'm thrilled to have you all, and I do think that this is going to be a really fun conversation, and I hope it's helpful to all of you. So we have a great panel, and I'm just going to dive right in on introducing them. So first we have Leah Gagan. I'm going to go in alpha order. So Leah is NU04, so BSN 14, sorry, not 04, 14. She's a board certified adult primary care and functional medicine nurse practitioner, and she helps individuals overcome chronic illness and achieve optimal wellness by naturally balancing the body, restoring function, and alleviating pain. Through her wellness company, Emergence Health, which I think she started just fairly recently, she blends Western and Eastern medicine practices based on patient preference, evidence-based data, and her clinical experience. So her assessment methods are scientifically proven and rooted in understanding a person's story, active listening, and detailed lab testing, which I think is so great. Leah has over 6 years of combined experience in nursing, working in the areas of transplant surgery, emergency medicine, primary care, and functional medicine. She holds a nursing and global health degree from Penn Nursing and a master's degree from from NYU's adult primary and holistic care programs. And her functional medicine training is through the Institute for Functional Medicine, IFM, and she's also certified as a medical marijuana prescriber in New York State. So welcome, Leah. Glad to have you here. Next, I want to introduce Ruthlan Greenfield Webster. So Ruthlan has a number of professional accomplishments and also some really fun ones. Thanks, Ruthlan. And I just have to say her background I love. So if you've been in Fagan Hall in the last 10 years, you have probably seen this art installation in the lobby. She is featured in it. She is the striving runner in the background right there behind her. So I love that you are using that. It's just so fun, so fun. So Ruthlan graduated with her BSN from Penn Nursing in 1992, and she was in the second class of that traditional Hillman Scholars Program with the New York work requirement, which I worked with for so many years and really loved. She has 29 years of nursing experience in a major New York City hospital as a staff nurse, assistant nurse manager across med-surg, hem-oncology, rehab, geriatrics, neurology, step-down, and respiratory care units. So lots of experience. Her current practice is in interventional radiology. She started her own legal nurse consulting business in 2000 called Greenfield Webster Consulting LLC, and it provided consulting expertise and nurse expert witness services to attorneys on medical and nursing malpractice cases. So just a couple fun facts. She is, as I mentioned, in the permanent arts installation that's in the lobby. And I love that it's a picture of you completing the triple jump, which is your specialty event. And it was from a 2010 track and field competition. She is the first Penn track and field school record holder to graduate from Penn School of Nursing. And you learned that fact when you received the Penn Friar Senior Honor Society's Friar of the Year in 2018. And she has also been inducted into the Penn Athletics Hall of Fame, and that was in 2017. So I feel like in recent years, we're hearing more and more about nursing students being athletes, right, and trying to get into that space. And you were at the cutting edge of this, breaking new ground, figuring out, I'm sure, how to make all of that work with the intense schedule of being a Penn nurse. So maybe we'll talk about that another time. But love it. Groundbreaker everywhere. So we have Tiffany Haddad. Tiffany, hello, welcome. Tiffany graduated from Penn Nursing in 2010 with her adult primary care and geriatric nurse practitioner degree. Since graduation, she has practiced as an adult nurse practitioner in several clinical settings, including integrative medicine practice, inpatient acute care for the elderly unit, and an urgent care center. She started volunteering with breastfeeding support in 2015, obtained her special certification as an advanced holistic nurse and international board certified lactation consultant, and then started a private practice. It's based out of Hoboken, New Jersey, and it's called Milk Body Soul. That was in 2020, which I'm sure adds a whole nother layer to this conversation, and provides advanced health care to lactating mothers and general lactation support through home visits, as well as office and virtual care. And I wish that you had been around just a couple years ago when I had my twins. It's been really helpful in this practice, that is. I also now want to move on to Antoinette, who I've had several times on these events, and I just love having Antoinette here, so welcome. She's calling in from South Carolina, which I just feel like is important to note because we have some regional diversity here. So she has a BA in education with a minor in Spanish from Emory. She has a bachelor's and a master's from Penn Nursing in pediatric primary care with a minor in global health, also from Penn Nursing. She is a pediatric nurse practitioner, of course. So she's also a wife and mother and is passionate about seeing children thrive in all settings and environments. It's near and dear to my heart. Antoinette is owner of Antoinette Montalvo Consulting and Coaching Services, where she serves as a community health consultant, coach, and mentor for nurses. She's also founder and an author of Visionary Nurse and co-founder of the Montalvo International Community Health Initiative. She has traveled and lived extensively throughout Central America and the Caribbean, which really solidifies her belief that cultural competency and sensitivity is key to establishing effective relationships in families. And she released her first ebook titled Visionary Nurse, 90 Days of Inspirational Musings on Being Influentially Visionary in 2019. And we got to feature her for a little bit of a book event, which was really cool. And last and certainly not least, we have our student member of this panel, Anthony Scarpone-Lambert. So if you've been watching our social media from the school or the news, you may have seen Anthony featured. He is the co-founder and CEO of Lumify Care. And even President Gutman has talked about this multiple times, which is, I'm sure he'll tell us a little bit more about. In fact, he's wearing, I think, your light right now. So yeah, beautiful, wonderful. So we'll get to that in a little bit, but thrilled to have him here. And I don't believe that was his first journey in this space in terms of new products and services and innovation. So we'll hear more about that. He's also a Hillman Scholar in the New Nursing Innovation version of this program, which is really not so new anymore, but to me it is, a couple years now. And he is a class leader, so he's executive vice president of the class board in 2021 and graduating soon, bachelor's level, and then continuing on to the PhD program. So all of you, thank you so much for being here. I know that sometimes it takes a while to get through those bios, but I feel like even those shortened versions can't even begin to touch all the amazing things that all of you have done. So thank you for giving us time and space to do that. And to all of our students and alums who are here tonight as participants, I'm really happy to have you. So feel free to use that chat function if you want to ask questions, just to introduce yourself. And even if you just want to direct something to one of our panelists, that is always fine. We want this to be interactive and to feel like it's answering the questions that you may have really specifically. And we will be following up, just so you know, we will be following up with information. All our panelists have all agreed to share their emails with you. So you don't have to be writing that down during the event. You can catch that after. So I'm just going to dive in. Let's get talking. Let's get this going. We'll get the juices flowing. And again, if anything comes up, feel free to raise your hand, to unmute and ask a question. Our panelists will be jumping in on various questions. And you can use that chat as well. So actually, before we do that, though, I quickly do want to say hello to Sarah Whitner and to Jody Feinberg, who are co-chairs of our Student Alumni Connections Committee, who really help bring these events together. So they help us find great speakers, they help manage this, make sure they're getting on the calendar and that we're getting them out. And if you want to be involved in this kind of thing going forward, they are the people to work with. They spend countless hours every month, and there is no way that we would be doing this and getting this done without them. So I just have to say thank you to them. So thanks for being here. They're awesome. So hopefully they'll drop their info in the chat too. And if you want to connect with them, you can. So first question, and I am going to pose this to most of you, all of our panelists, so feel free to jump in, which is really, I want to know about your current professional role. We talked about that in your sort of bio, but what was the journey to getting to that role? So I'm going to start with you, Ruthlan, and we're going to move to you, Tiffany, and then we'll just keep flowing through the conversation. But if you could tell us, how did you get where you are and what was this journey like? I think it would be really helpful if people are here. So Ruthlan, to you.
Okay. Can everyone hear me? Okay, good. So, well, as you already know, graduated class of 1992, and my original plan was to go back to nursing school for my master's in probably a couple years or so, just get a couple years of experience under my belt. But as sometimes happens, you start working and you start getting exposed to different things, and plans change. Just fast forward about it's about, I think it's 2000. Yes, about 8 years later. But I ended up moving up the ladder, senior nurse clinician. I went into management, assistant nurse manager. I put off going back to school because I started getting exposed to just different things that I was encountering as a nurse during my clinical experience. So I said I just wanted to kind of practice some more and see, see what happens before I decide what I wanted to go back to school for. But as that kept going, I happened upon reading in one of the nursing magazines that I had subscribed to, the clinical magazines about legal nurse consulting. And I always had sort of an interest in legal issues, and not so much being an attorney, but just legal issues and how that whole thing works. And I said, this is, at this time, I had about 8 years of experience by then, and in a couple of different areas. And I said, this would be a good way for me to marry the two, use my years of experience and also delve into this other specialty or profession, the legal field, and marry the two interests that I have. So I happened upon an advertisement from who is actually the pioneer of legal nurse consulting, Vicki Malazzo. She was advertising her business. And I decided to take that course. And the funniest thing is I never, ever thought about business. I had zero interest in business. That was not something that I ever wanted to do, never thought of, nothing like that. But again, the interest in the legal issues and my experience in nursing, and I said, this might be something, sounds interesting that I could do this. And so I took the course, which was a 7-week course, a week course, 7-day course in Philadelphia, became certified, and started my business. If I don't want to talk too much, because if Monica's going to ask me another question, then I can go through how I built my business. Otherwise, I'll end up answering that question here too. But the bottom line is that's how I got started. I was running my company for 10 years, and I'll talk later about why I stopped doing that. It wasn't a bad reason. My passions and interests tend to change. And I'll touch on that also shortly, about my motto of live life with passion. But I did that for 10 years, but I'll talk more a little bit later about how I built my business from my interest to running the company, et cetera, et cetera.
That'd be great. Thanks, Ruthlan. Tiffany, do you want to share a little bit about your journey?
Yeah, absolutely. So when I graduated, I had about 2 years of working in geriatrics, and then I had a move from Philadelphia to the New York City area. And then I also had children. So it was a lot of changes at once. And I started finding myself in jobs that were convenient with the scheduling, or shift work. So they worked really, really nicely. And then through having children, I realized that there's so much really bad advice when it comes to lactation, or I had really a lot of struggles with my first child, and so many differing opinions. So that's when I started volunteering to be a breastfeeding support person. And then I realized medical professionals and lactation consultants are not talking, and they don't interact. And people are left with like poor medical advice because it's just not part of the training. So my goal was really to fill this gap. The other part is that, as we know, like, you have your baby, you're seen every week sometimes when you're pregnant, and then you have your baby and people kind of say goodbye to you and, see you in 6 weeks. So I really want to fill that gap and like really provide more medical based care to these moms who are like kind of stuck in this like hole that we have. And it also helped me get out of the trap of like finding these jobs that the schedule was nice. And I was like, you know what, I can build my own schedule. The other part of it is every job I had, I wanted things to be done the right way. And there's sometimes a lot of red tape, and it's hard to like do things the right way. So I was like, it's about time to just kind of take things into my own hands and really make sure that I'm doing things exactly the way that I want them. So that's kind of where I landed. That's where I got where I am now.
I love that. I love how it's, sort of a need and a gap that you saw And with your background and your expertise, you could bring all that together. So thank you. Leah, I know this was a question that you had also said you might like to answer. So can you tell us a little bit about your journey and your new company?
Yeah, sure. Hi, everybody. Thanks so much for arranging this chat today. As Monica mentioned, I am fairly new to the entrepreneurial space. I started my business 6 months ago to actually the week. So it's a reflective period right now for me. But I started my career inpatient in New York City at NYU. And I worked in transplant surgery for many years and then also in the emergency department. And I loved working in the ER. I am somebody who stays very calm under pressure, and I love the aspect of teamwork and intercollaboration between different professionals. But over time, I started to get really frustrated working in the ER because I noticed that we weren't actually healing people and that our system was designed to stabilize acute care patients, but it wasn't designed to take care of chronically sick patients and actually reverse their illness. So we would have somebody come in with a heart attack and we would work as a team to unblock the artery that was clogged and would then send them home to continue, eating their bad diet and not exercising and not making sure that they're following up with who they need to. And I realized that I wanted to be on the side of healthcare that was more proactive and that helped to keep people out of the emergency room. So that's why I decided to go back and get my master's in primary care. And NYU also has a holistic program too. So I was actually able to learn about holistic treatments, how to integrate them into the Western model of care. And then I went beyond that to get a certification from the Institute for Functional Medicine, which for anybody who doesn't know, functional medicine is a way to approach healthcare that looks at the different systems of the body and how they relate to one another and fixing the problems that are going on in someone's body at the root cause. And we mostly use things like lifestyle intervention, sleep, stress reduction, sometimes supplements and herbs in addition to medications to help people get back into balance. So I worked in a holistic practice for about 3 years. And then when the pandemic hit, everything kind of went topsy-turvy, which I feel like a lot of people can relate to, no matter where you are working in the healthcare space. And I noticed working in New York City that my patients did not feel comfortable coming into the office to see me to receive their routine care. And there were so many things that I can't even imagine right now that were getting missed. And I realized that the current model of care was not very supportive towards nurse practitioner practice. And I was hitting this ceiling where I wasn't able to practice at my full scope when I was working under another professional. So between those two things, I decided to take the leap and quit my job in the middle of the pandemic and start my own practice that is telehealth and home care. So I do physical exams in people's homes. I do COVID-19 testing in their homes. I bring the care to them wherever they feel comfortable receiving it so that there isn't that hesitancy to get the care that they need. So yeah, that's kind of where I am so far. Evolving journey.
Yeah, that's terrific. That's great. So Anthony, I'd love to hear just a bit of your story too. I know we'll get to more questions for you. And then Anthony, we have to hear too about your experience on product side, which I think is a little different than some of these services that folks are providing. So I'm just going to ask you guys to, Anthony, if you wouldn't mind sharing a little bit, and then we'll circle back to everyone with some of the other questions.
Absolutely. And if for some reason it seems like my internet is choppy, I do live in the rural South where there is not the best Wi-Fi. So it seems like I'm frozen or my face does, some kind of weird thing. It's just the byproduct of being here. So I feel like my story is much like Ruthlan's in some ways, that I wasn't expecting to go into the business side of things. I think for most people, I don't think anyone's ever really expecting when you start off in nursing to go a whole different direction. But it was definitely something that was always kind of rolling around in my periphery. Even while I was at Penn, I was always trying to create some type of business or service or consulting model. So I participated in the Penvention competition, which it might have a whole other name now. When it was first starting with the engineering school in combination with the nursing department, and a group of nurse colleagues and I developed a board game that we launched in using with a variety of different clinical sites that we were in through our community health sites. And it was always kind of the peak interest of my community health, wanting to find ways, even as a clinician, finding better ways to impact the community, finding better ways to be more holistic in the approach, and also finding ways that what I was seeing in clinical practice, the limited amount of opportunity that I had. I worked when I was very heavily clinical, primarily in North Philly, and there were just a lot of challenges that came with the care that was delivered. As a pediatric clinician, you saw outside of just the care of the child, there was the care of the family, there was the care of the community, there was the stressors of the community at large, and a lot of, just even my experiences and troubles or not troubles, but the things that I was concerned about was primarily, and the travels that I had was about how do you blend and create more sustainable community health interventions that will ultimately influence the child, because that child may unfortunately have to switch between caregivers. There may be a break in care. There may be a lot of other factors that influence it. But how do you meld that? How do you make that better? How do you make that more sustainable? So that, I had this insight that a healthy community ultimately makes a healthy family and ultimately makes the healthy child overall. And so I had this kind of wild decision to leave Philadelphia and move to the very rural South. And when I say rural, like, we were social distancing before it was a thing. Like, we literally live in the woods and where we live, there's our driveway's like half a mile long. Like, it's deep South, right? And it can be kind of shocking of like, why would you go there to suddenly start a business? But it's like the business kind of happened upon me. So while I was there, the main portion of it, as Monica had mentioned in my bio, was about starting this community health initiative. I had this big lofty goal of being able to take my clinical skill set and apply it in a way that would blend my love for health and education and find, a more innovative and effective way to deliver care. And this was before, innovation became the buzzword, and now it's like everything that anyone's ever saying. But I didn't realize the challenges of being innovative in a small rural town, especially in the South, where there is very little autonomy. It's a lot more now, especially as a result of the pandemic, for nurse practitioners. But I was confronted with a lot of different pushback and resistance. The initial partnerships that I was going to have in terms of even starting a community health center were immediately squashed because the provider that I was going to work with ended up relocating. And a lot of people had trouble with the new ideas that I was presenting. And so I found myself being very inspired by one of the Robert Wood Johnson reports that was released in 2011, talking about nurses as change agents. And it really resonated with me because at the year that I was at Penn, the dean at the time, the big slogan was "Dare to Change the World." So I was like, I am going to create whatever the vision is inside of me. I know these are the things that I want to do, but it's not about the system. It's not just about the center. It is about the vision that I carry, regardless of the pushback that I receive. And you'll probably hear a little bit more of kind of the challenges that I've experienced as I evolve with that. But as you can maybe guess, for anyone who's kind of tracked some of my branding, it's really where my tagline of the visionary nurse came about. I recognized that I wasn't, in what people put in quotations, just a nurse. I was a nurse. I was a change agent. I was someone who could really see the nuances of healthcare outside of just the traditional healthcare system, within the community setting, within faith-based institutions, within libraries, within schools. How can you take a system that might be inherently disconnected or disjointed, especially within rural areas where you don't have as much infrastructure as you might have in city areas, and essentially transform that, creating care that's sustainable and that you are using across sectors. So not just in nursing, but how can I create a culture of wealth and of health and of education that all ultimately influence health. So I would talk to anyone that would listen to me, and as a result of it, everyone wanted to listen to me in a variety of different ways. So I found myself on boards of our Small Business Development Center, as well as giving talks on population health and finding ways that nurse practitioners could really be leveraged to make an impactful change within healthcare. Not knowing that we would get not 1, but 2 years of being the year of the nurse and midwife, but just really understanding that nurses carry a strong influence within the healthcare system and how communities are shaped. And so as a result, I ended up publishing an ebook. Really, it was a portion of it was just to keep myself motivated from from lots of pushback that I experienced and lots of rejection that I experienced, but just recognizing how to reflect through that. But as a result of also building and kind of executing this grassroots health initiative, many nurse colleagues of mine at that time came to me and said, how do I do what you're doing? I am not happy with what I'm experiencing. I'm experiencing burnout. I get a lot of pushback. I want to see change. I want to do more outside of the sphere of what traditional nursing looks like. I want to pivot. What do I do? And at the time I thought, I'm just figuring this out. But then I recognized, and actually Ruthlan was very instrumental in those early days, several years ago when I was getting started, just saying, if people are coming to you, then you have value. If people are being changed by what you're saying, then you are allowed to charge for what you're providing. And I recognized that it wasn't just about charging for a business, but it was recognizing that I had inherently a solution to a problem that people had. They weren't sure what their vision and their outlook was. They wanted to see how they can apply their unique skill set of nursing or whatever it might be, but specifically in healthcare. And they wanted to find ways to be innovative in that approach, because I think if anyone admits to themselves, they are multifaceted. They had many different ways of how they want to approach life. It might come out as a hobby. It may come out as a side gig, but really recognizing that holistically as people, we have many aspects to ourselves, and we want to execute that in a way that's sustainable for us, but then also to be influential to other people. And so as a result of it, a coaching and consulting business was born, and this kind of business and branding as the visionary nurse. And I've had an opportunity to specifically coach and mentor nurses in a variety of different situations and opportunities. And even though I'm way here in the rural South, getting a chance to connect in many, many different ways, but just transforming what was, I guess, a story of resilience and resistance, but also turning that into vision and innovation to encourage other nurses to recognize their own unique skill set and say, you know what, regardless of what it looks like now, I can take what I have, turn it into something different, and ultimately impact many more people in the process.
Thank you so much. I feel inspired
So
every time I listen to you.
Came through clearly and not too choppy.
Perfect. Perfect. And you're probably the only person I know, like, your face froze for a little bit and it was beautiful. It was perfect. Mine is always wonky. So good. Nice job. Very nice. So many great things. Anthony, though, I have to turn to you now. So we have one student member of our panel today. Still, in undergrad, but finishing up at the School of Nursing. And you have been in this really interesting, unique innovation space. And I feel like that's something that Dean Viruel really sees as a touchstone and a keystone for her deanship and for the direction of the school. And I think you with your skills and who you are as a person, but also just sort of came together with that. And it feels like it's a great mix, and that it's really allowed you all of this together, right? And you've just taken it and you've done some really cool things. So tell us about Lumify Care. And I think, was there a text 911 probably before that? I might be making that up a little bit, but you've had different journeys along the way. So tell us how you got here.
Sure.
You're not even done yet.
A bit about my journey. I'll try to keep it brief just because I want to give time for questions from everyone. But hi, everyone. My name is Anthony. As Monica shared, I'm a senior in the undergraduate portion of the BSN, and then we'll be continuing at some point to finish the rest of the PhD program. But yeah, my experience at Penn has kind of been all over the place. Early on in my Penn experience, I started a nonprofit with a friend in Wharton that basically was expediting the process of implementing emergency text capabilities in all US counties. So basically helping dispatchers develop the service to text 911, which is super important for populations such as the deaf community, victims of domestic violence who aren't able to verbalize their emergency in front of their abusive partner, school shootings, the list goes on. But at the time, only 40% of US counties had the ability to receive text messages, which is kind of insane considering we all have smartphones and we live in this 21st century world, but we can't text a dispatcher if we have an emergency. So I worked on that for about 2 years and got to impact over 1 million Americans with the ability to text 911. So it's just a really awesome kind of entry point into this world of entrepreneurship and innovation, and kind of just leveraging all of the great resources here at Penn and Penn Nursing. So when that chapter started to close down, I knew that I wanted to really start utilizing my nursing perspective more, having been in clinical throughout nursing school and seeing so many problems on the front line. I think very similar to what Leah had shared, one thing I was always really surprised about is how clinical environments are just not conducive to comfortable patient experiences. It's loud, they're disruptive, patients can't sleep, there's a lot of smelly things, there's a lot of noises. It's just kind of paradoxical to me because hospitals and clinical environments are supposed to be places where patients actually do heal and do get better and recover. So I kind of saw that in all my clinicals and talked to patients throughout my first 2.5 years, and decided that I wanted to do something about it. So I'd actually gone to a nurse hackathon back in November 2019. And if you haven't heard of hackathons, I think they're a really cool way to kind of get involved with nursing innovation, just because they kind of, I think, in essence, really provide you with a community of other nurses and healthcare workers and business people who are interested in supporting nurse-led innovation. So I met a lot of nurses there. I actually met my co-founder for Lumify Care at the hackathon. And a year later, we're launching our business, Lumify Care. We developed a wearable LED light for nurses, specifically night shift nurses, as our first end user, to basically illuminate their workspace in a non-disruptive way. And we launched 4 weeks ago, and we're already selling our product to all 50 US states, which has been insane. It's probably why I look very exhausted right now, because it's just been kind of challenging, to be honest, to juggle with clinical. As you can tell, I'm still in my scrubs. I just came from clinical. So I'm working 2 days a week in clinical, and then the rest of the week I'm just full-time with Lumify, because we have, just really pumping out our product, getting manufacturing to scale, and getting this into the hands of as many nurses as possible. So it's really been a journey, a roller coaster, lots of resilience. I think that especially as nurses, we don't always get that education about, business and finance and developing a marketing plan or a pitch deck or pitching to investors or speaking with, other startups. So I think that a lot of it had to just be me having a really big growth mindset and utilizing my resources and asking for help. So I think that's an important message for anyone who's interested in kind of developing an entrepreneurial venture. Like, you totally can do it. There's a statistic out of Penn Nursing that says that leaders surveyed from both clinical and business sectors agree that nurses have the greatest opportunity to utilize innovation to transform and improve healthcare by 2025. And that's really because we have the perspective of what is wrong on the front line. And a lot of healthcare startups out there that I know are just random business people that really don't understand healthcare, to be honest. Nothing against them, they're building great things, but as nurses, we have that perspective and we have that power, which allows us to create really meaningful solutions. So yeah, that's a little bit about my story, but definitely excited about the future and driving forward nursing innovation.
Thank you for that. That's always impressive to hear all those numbers and everything that you have to share, Anthony, and how you're doing that as a full-time student, going to your clinical and everything. Bravo. So yeah, hopefully you get some sleep in there. So one of the couple things that have been brought up that I really want to touch on, and I feel like this is going to be a challenge because we have so many great things to talk about. But what I want to hear is, what maybe do you all wish you had known when you were first starting out? So let's sort of, think about that a little bit and give some folks some thoughts there. Leah, I'm going to start with you, and then Antoinette, I'm going to go back to you. And if anybody else wants to jump in from the panel, please feel free to do that. But yeah, what do you wish you had known at that point? And maybe if you want to touch on as well, how did Penn Nursing prepare you for that role? But what do you wish you had known?
Yeah, absolutely. This is such an important question. For me, especially coming from Penn, where we've always been taught that we're going to be the leaders of innovation in the field. And I feel like that was really infused into a lot of our courses that we took. For me, I wish that I knew the value of getting involved in healthcare policy earlier on, because now that I am running my own business and I'm kind of going to almost the fringes of where like nurses have ventured before, I'm starting to meet a bunch of roadblocks. And anybody here, I'm sure, can attest to that who's been doing entrepreneurship as a nurse. There is a lot of red tape and a lot of bias still towards nurses that we're not MDs, that there are certain things that we should not be doing, or even though they're technically within our scope of practice and we've been trained to do so. I recently actually moved to Pennsylvania, even though my practice is still based in New York, and I just got certified as a CRNP in Pennsylvania. And just understanding the different policies and nurse practice acts between those two states and how much more restrictive it is here in Pennsylvania to do the same thing that I can do in New York without much oversight has really opened my eyes to that and has made me reach out and get more involved in a lot of healthcare policy, following the different bills going through the Pennsylvania Senate to increase full practice authority. And Penn has been really instrumental in that too. As an alumni, there's a program here called Penn LDI that's all about increasing scope of practice for nurses and nurse innovation. And they actually had a conference in the fall that I found really eye-opening and was really great to just see that Penn isn't just a leader on paper and through the different networks that we see, but they're also working to push that boundary and to allow nurses to really step into the leadership roles. So yeah.
Thank you for that. Antoinette, anyone add?
Yeah, no, I think Leah's comments were great as it applies to just knowing about health policy and how you are going to apply some of that information. Just because those right now, there's a lot that you know on the very, I wouldn't say just surface level, but there are a lot of deeper aspects to health than just the care that you deliver in front of you. And I think it's worth for nurses to know some of those additional layers, just because I feel like it gives you a little bit more leverage about what you're doing and why you're doing it. So, if you have the space and the opportunity to do that, I think it's important to learn. But in terms of for my own personal self, things that I wish I knew, I think the biggest piece was establishing boundaries sooner. And I think that plays into some of the other questions that Monica may ask, just in terms of just the failures or challenges that you experience. But especially when you're going into the space of entrepreneurship and innovation, it can be very easy to just keep going and going and pushing and saying yes to all the things. But eventually you will burn out, which most people try to go towards entrepreneurship to find something new and different. And if you just keep going at that pace, it'll take away the desire that you have to accomplish what you need to have. And it doesn't mean that you shouldn't have some level, again, of resilience, and you shouldn't have some level of self-motivation to continue going. But even if you are just starting, you are allowed to say no to things. That's healthy and that's necessary. And I think it's important, even as you to practice what you preach in that aspect. And I know in the very early days, it was very easy for me because I was just trying to navigate, the value of what I was doing. It's a completely new space. No one else was doing what I was doing. So I thought, yeah, I'll just try out all these different things. And there was a lot of valuable content that I gave out for nothing. And it was frustrating to a point. And I found myself saying, how am I supposed to be doing this? Or I would give out some type of content of some sort, and then the next day the person would say like, oh yeah, we loved what you said, but we're not going to help you achieve what you're going to achieve, but we'll actually apply what you're doing, and off you go. And so I think it's really important to understand the value of what you have to bring, number one, knowing that even if someone else isn't valuing that right away, doesn't mean that it's any less valuable. It just means they don't see what that potential is just yet. And it also means that you are allowed to hold on to what is inherently your trade secret, your patent, your specific registered thing. Because I think a lot of times, again, as inherently as nurses, we want to give, we want to fix, we want to be generous with what we have. But especially when it comes to the space of entrepreneur and innovation, a lot of the the success comes from also who gets there first. So it's not only the generosity of the solution, but who's going to get there. And so the unique stance that you have is valuable. And knowing how to place the boundaries around that so that not only can you bring the solution to help many people, but you also don't feel constantly shortchanged, as if you're giving a lot and not getting at least some. You are switching to a whole nother sphere. It's not only the nursing side, but it's also the business side. It's also the strategic thinking side. It's also how you're going to collaborate and with who you're going to collaborate. Those are very important pieces to sustainability. Again, not only for yourself, but for your future vision and your future business. And if you have the vision in business, you are the best person equipped for that. And I think sometimes you can downplay yourself of thinking, oh, well, I don't have all the details. I don't know all the ins and outs. So I don't know if I should be doing it. But I could say, yes, you are the one to do it because you were the one who had the idea. Even if you need additional people, it's okay to kind of put those boundaries around yourself so you can have time to navigate what you need to do, and that you don't ultimately lose the desire and drive that you have to make a really amazing impact for others.
Thank you. Thank you. And you touched on something there that that's coming up in the chat. So there are two great questions there. I want to get to both of them. I'm going to start backwards though, because you mentioned a lot of the business skills and some of those things. And I know, Anthony, you started talking about that as well, how you've reached beyond in a space that was a little less comfortable maybe, but, jumped in and found what you needed. So I would love to hear from folks in answer to Annie's question, is it necessary or helpful to go back and actually get a business degree, number one, but also, in the spaces that maybe you haven't had as much information in terms of negotiation, budgets, all these other places that I'm sure are incredibly helpful at bringing your business model together. How did you fill maybe some of those gaps, and where did you go to get that information if it wasn't back to school? What was helpful in that space? So I'm going to open that up. Anybody who wants to answer that, please feel free to jump in because I think that's so critical.
I can jump into this one just because this is something I'm super passionate about, just because I think it's something that comes up a lot, especially as I'm pitching to investors and things. People like asking me like, oh, why didn't you just go to business school or something? I think the reality of the situation is that to be an entrepreneur, you don't need to go to business school. There's so many entrepreneurs out there that have created billion-dollar companies that never had a business background. And I think sometimes that unique perspective is actually even more valuable. I will say, however, in the reality of growing a business, you obviously need some of those just foundational skills that I spoke about, whether it's projecting your finances for the next 5 years, whether it's just creating a pitch deck, marketing plan, some of the things that I kind of alluded to earlier. But the great thing about our world is that, all of these resources are really at the tips of our fingers, especially here at Penn and the alumni network. And that's, I think, how Lumify really strategized how we wanted to kind of scale more of our business side of things. We reached out to alumni of Penn. We reached out to different mentors via LinkedIn. We cold emailed a bunch of people. And then we also found opportunities to learn ourselves. So currently, for example, we're in a startup accelerator out of Richmond, Virginia, which is basically a 3-month program that you can be accepted into that gives you funding and then also gives you kind of like these workshops and mentors that allow you to build business acumen and kind of just redefine all of the different parts of your business and kind of just polish it up. So I do think there's a lot of resources out there to learn. So again, I feel like if you keep a growth mindset, like you can do it. It can be frustrating at times, especially for me, like things like accounting and legal things like patents, it just gets like a little bit tedious. But I think if you just remain resilient and focused on your goals, you don't need to go to business school.
And I'll add to that it's also really important to...
Yeah, I would also agree with Anthony for sure.
Whoever's speaking can go. Antoinette, I think it was you.
Oh yeah, no, I'm the delayed one. So if I'm talking, it's yeah. But yeah, no, I mean, just piggybacking off of that, yeah, same thing. I definitely devoured a lot of resources that were out there. So I spent, when we were actually able to go out more, I spent a lot of time in the library. I checked out every single possible business book that I could, anything that had to do with strategy or finance or structure or business plans. I was open with myself of what I didn't know, and I just networked and networked and networked. So I also got very plugged in with, just our alumni network, and there's a ton of people that are doing a lot of amazing things that didn't necessarily also go to business school. There's a lot of free workshops and certificates that are out there. I listened to every possible podcast that I could listen to, especially when I was first starting off, again, rural area, the commute. And when I was teaching as an adjunct and I had to go in for classes, it was at least a 30-minute drive. So I would pop on a podcast every single morning in between commutes just to learn, just to absorb information, just to make sure that I was learning something. And then I also got very much connected with our Small Business Development Center, and they have been instrumental. So working with the small businesses that you need, because I think, as Anthony mentioned, the unique perspective that you carry in nursing actually may set you up better for producing and performing in the business that you need to. And if you need additional assistance along the way, that's fine. But I think sometimes you end up delaying yourself of launching, executing, performing, doing whatever the thing is that you're doing, waiting to think you have to add more formal education to it. And maybe later on you might find that you want to do that. But I think in terms of actually putting together what you need to put together, a lot of the skill set you already have, but it's worth putting some of the structural things in place. And there's a ton of resources that are out there at your fingertips for free: audiobooks, books, actual books, podcasts that will give you a lot of the foundational skills that you need at least.
Yeah, thank you for that. And Leah, I know you wanted to add to that as well. Tell us about yours.
Yeah, so I completely agree with what Antoinette said. That was very well articulated, and same with Anthony. But for me, I think it also requires a lot of self-reflection and realizing what you want your role to be in your own business. And whether that, for me at least, wants to be client-facing and be the one delivering the healthcare, or the person really running the show. And I think it's okay to have those real conversations with yourself and realize which things you're good at, or which things you want to learn, and which things you want to surround yourself with people that are also experts in that field, who'd be willing to kind of fill those gaps. Because sometimes putting the effort into you really learning something inside and out to do it, when it's not something or one arm of your business you really want to be managing, that's where the role of delegation and figuring out and staffing people around you that you trust, who are aligned in your goal. And that's something that I've definitely struggled with in the beginning, kind of letting go of the reins a little bit and being really mindful about who you bring in to help you. But I do think that that's essential for scaling a healthy business. I forget the last thing I was going to mention, but I think that that's really important.
Yeah, thank you for that. So there's a question in here, and I know that you started answering it, which is terrific, Ruthlan. So Sarah asked, how do you jumpstart a business when the product is education, right, versus a tangible product? So I know you all have different experiences of this. Some of you are selling sort of an idea or your expertise. So you have some different angles on this. Any thoughts for Sarah in addition to what Ruthlan has shared here for her? And Ruthlan, feel free to jump in here too, but.
Yeah. Was someone else going?
Go ahead,
Okay.
Ruthlan, and then Tiffany after that.
Okay. When you don't have a product, like my business wasn't a product, the product was me. So I totally understand that question, where it's like, how do you promote yourself? And in terms of Sarah's question, education, and it basically is similar to my business. I was selling myself. My services was educating attorneys, utilizing my expertise based on my years of experience. So what I had to do was, as I said to Sarah, you sort of have to sell yourself, which sort of speaks to the one thing that's one of the questions where you said a challenge or an obstacle. Cold calling was like my obstacle. I don't like the idea of trying to sell myself to people, but that's what I had to do, and I had to overcome that. What I had to do is identify to my potential attorney clients when I was promoting my business in various ways that I'll go into with another question that Monica has. But I had to identify to my attorney clients what they were lacking and what I brought to the table to fill the needs when and if I would be the person that would be consulting on their cases and providing my nursing and medical expertise to their cases. So basically, find the hole that needs filling, identify it to your client, provide and really show them what it is that you have to fill that gap for them, to fill that need, and then really just sell yourself. Show them that in my case, my expertise, my experience. I went into the fact of how detailed I am when I do cases, in my clinical practice, et cetera, et cetera. But the bottom line is, figure out what it is you feel that client needs, show them what it is that you have that you can give them to fulfill that need, and then really, really, really sell yourself as the expert in that.
Okay. Tiffany, you want to add anything?
Sure. I was going to say, health education, I think, is really challenging to sell in many realms because we often don't seek healthcare until something's wrong. And a lot of what I do is trying to do preventative medicine, right? And sometimes it's a hard sell, but the way I kind of started is selling it to the people that are easier to sell to, that have already bought into it, who are already doing other things, and then building your name from there and letting it kind of explode from there.
A great idea. And so I'm seeing questions about how to identify a team. And Anthony, you had mentioned that, having a team is really important, especially in a interdisciplinary team. And it seems like even just if you look at the numbers, right, Wharton is graduating lots of people. Penn Nursing is graduating less. So there are a lot of business folks out there that we can tap into. But how did you go about finding those folks? I know you mentioned hackathons and other things. And Leah, I know you said that, you had to find other folks to bring in to consult with or, help think through issues. And so I'm curious if folks want to jump in on this a little bit more. What do you recommend? How did you figure out who you needed and when, and find the right folks for that?
Yeah, I mean, it's a really important question and probably one of the hardest parts of entrepreneurship, because human capital is really one of the most important parts of scaling a business. You can't do it alone, and you can only get so far growing a business as just one person or even two people. So recruiting and things become really important, especially as you're growing quickly. So that's something that Lumify is facing right now. In the early stages, we basically had just brought in a bunch of interns, which was kind of supplemental work for us to get different skills in our team really quickly. But now I think how we're growing our team is really, one, I think looking to people we've worked with before, especially when you're such a small team. I think it's really important to try to find people that you've worked with and have at least some sort of rapport with, or, kind of what their expertise is. And second, I think is really just that idea of networking. I think the hackathons that I mentioned are a really great opportunity to do that. Getting connected to people through mutual colleague. I think that's, one of the best ways to do it in the early stages, just getting referred to people. But there are resources out there to find a team as well. I know Y Combinator, which is a really famous startup accelerator in San Francisco, has a database actually, which you can kind of network with people and find other like-minded individuals who are looking to start an early stage venture. And as Monica said, the benefit that nurses have is we have so many ideas, and there are a lot of people out there that are looking to actually work and develop ideas. They just might not know what the problems are. So I think keep that as something that can empower you.
Yeah. Don't let them steal your ideas, though. Work with them. Don't give it to them. Good. Leah, were you going to say something there?
I completely agree with Anthony. And I think part of it is really sometimes reaching that capacity and realizing, what is taking up the majority of your time. We only have a fixed amount of time during the day. And when you are working for yourself, your time is so valuable and it actually has a dollar amount attached to it. So realizing what you are spending the majority of your time on and whether or not that is furthering the growth of your business is really essential. And I do that with my team through Scrum huddles, which are basically like huddles I do with my business director, and I have a nurse that works with me, contracted, and my receptionist. I do that twice a week just to see what everybody is working on, which things might get pushed week to week if, you know, they're important, but they might not be getting to it, and really identifying those gaps or those leaky buckets within your team to see whether or not somebody needs something delegated away from them, or if you do need to bring somebody in. And I think it's important to note too, I mean, Anthony mentioned that he used interns in the beginning, and it can be a little bit intimidating to think about hiring somebody, especially when you're just starting out and you might not have that revenue stream going yet. And there definitely are other ways around hiring just somebody who's salaried that you need to provide benefits for. Especially in the nursing space, there are nurses who are interested in working with nurse entrepreneurs who'd be willing to be an independent contractor, which is basically somebody that you would pay only when you needed them. And for tax reasons, you don't need to provide them with benefits because they have another full-time job. So there definitely are ways to work with somebody's schedule and with your own finances to get the services you need without having to break the bank, at least in the beginning, and bring on somebody full-time.
Go ahead, Ruthlan. Do you have something to add?
Oh, yeah, I know we're running out of time, but I quickly wanted to just touch on a few things to advise. I know we're talking about teams, but if like my industry for my business was totally individual. So I wanted to just touch on some advice that I may give to, you know, those of us who may have individual businesses where you're not surrounded by team members that you can delegate, and it's all you, and you delegate to yourself. Anthony, you know, was touching on, and he was correct, you know, and I'll use my what I did as sort of an example, but, you know, feel free to apply it to your own business. And I think it probably will apply to a lot of the entrepreneur businesses who are listening. I took an entrepreneur, well, I first did my certification course, I told you, a week with the Vicky Milazzo Institute. And she's the pioneer of legal nurse consulting, and that was my business. And then, like I said, I didn't have any interest in business, zero. I don't think I ever took one class in Wharton at all. So zero business skills, but somehow after I took the course, she had laid out different ways that you could practice legal nurse consulting. You can just do it yourself, and you're the expert, and you sell your services, which is what I did. But I also had to think about the liabilities, and that's what you also should think about when you're starting your business. The liabilities to yourself when you're giving something, especially something like mine, a personal service where it's your expertise that is the service that you're providing. It's really important to think about liabilities. So what I did, I decided to form an LLC, and I hired an attorney to do that for me. Pretty sure you can probably do that without an attorney, but since I knew nothing about it, I wanted to make sure it was done the right way. So that's one thing. Just make sure you know, I would suggest, if you don't have any kind of business background, that you do take, you know, some small entrepreneurship course or offering. Mine was like one night a week, I think, for maybe 6 weeks or something. But it taught me a lot about business, how to build it, the different entities, LLC, do DBAs, you know, sole proprietorships. And there are a lot of differences between the two in terms of risks and benefits, legal, personal liabilities. So make sure that you find out those, however you find it out, make sure you learn that when you're launching your business. Create a promo package that talks about your services, price list, business mission. I did cold calling. I actually would just dress up and walk, you know, in attorney rows and just go in and say hi. Like, this was grassroots like back then, but I would still do the same thing now. But you really got to get in there and do it all. Learning about, for instance, like QuickBooks, you know, whatever sort of entity can help you with the financial aspects of running your business. So there's a lot that you do need to learn if you're going to start a business. Take the time to do that, because you don't want to get into a situation where you're providing services and you get blindsided by something. In terms of my legal nurse consulting business, and networking. Anthony, I think you touched on that in terms of networking. Network. I mean, attend all the networking opportunities that you can, find. Join your specialty organizations for your business. Join your local chamber of commerce, your local organizations, and get involved in any organizations that are part of your specialty area, because you can get referrals from like-minded business owners. You can join together your businesses. There's just a lot of opportunities. So I just wanted to throw some of that out before we convened to try to help.
Thank you so much. There are so many questions that we had thought about and wanted to answer today, and more I'm sure that you all have that I'd love to touch on, but we are out of time. And so I'm going to do two things. One, I'm going to ask our panelists to just do a quick fire round of what does it mean to you to be a nurse entrepreneur? So you can think about that for a second, like 10 words or less. We're going to go through and you can answer, just help us wrap up. And then I'm going to also ask my colleague, Ivory, to post in the chat some of the alumni resources we have. So, folks in here were mentioning as we were getting started that they've talked to each other and they were instrumental in each other's businesses and ideas coming together. And so you have this network, whether you're an alum or a student, you have this alumni network here at Penn Nursing, but beyond at Penn. And so I think My Penn is a great resource for you. That's the Alumni Directory. All students and all alums are part of that automatically. You might need to go in there and just turn on your account, but you can see the link there. I suggest that you check it out, see what people's professional journeys look like and sort of what jobs they've had. Are they doing something, or have they done something? You want to reach out. You can say, I'm a Penn student, I'm a Penn alum, and people are great about answering that. I found so many people have been just really open to the idea. Also, I want to mention that we do have a mentoring program officially now at the school. We've done it in one-off ways before, but we have an official mentoring program now between alums and students. If you'd like to be part of that, we'll drop the link in here and also in a follow-up email. It's a great way to just have someone on your team from the nursing school and you can let us know, what you're thinking about doing, and we'll look for someone. There's probably someone out there who's done it. It's a great way for you to connect. So right before we go to our round rapid fire, I just want to mention that there have been a ton of great recommendations in here from a number of our panelists. And also Sandy Sandberg. Sandy, I have to say hello to you. I should have called that out sooner just to say hi, but Sandy is one of our great entrepreneurs, started multiple things. Sandy, can I just ask you to say hi quickly? I'm sorry to do that at the end here to you, but I couldn't leave without you being on.
Thank you. This was so great. I'm so inspired by everything everybody here has done. So I've done a handful of different things, and I'm more in the nonprofit world now. So it's a little bit different, but similar in a lot of ways. And I related to so many of the things that you shared and the advice and, building your team. I would say culture. It is so important to work with people who have similar values to you, that you do. I feel like you can train people in a lot of things, but making sure that, you have people who I don't know. I'm not being very articulate. I've been up since 4 a.m. and I'm just fried at this point. But anyway, I'm just really glad that I was able to join this. And I hope to continue to attend these things. So Monica, thanks for the invite.
Sure. We'll have to do this again because clearly there's so much more. So thank you, Sandy. Thanks for sharing with us. And I know Sandy, you'll find her if you look up in, My Penn. You can always reach out to her, I'm sure, and ask her questions as well about her businesses and things that she started and sold and moved on, and all of her new ideas that have been so exciting. So rapid fire before we close. We're going to go through what it means to you to be a nurse entrepreneur. So I'm going to start with you, Tiffany. And then Ruthlan next, because that's who I see across my screen, and we'll go from there.
Sure. Yeah, to me, it really means complete freedom to practice the way that I want to practice, provide the care that I absolutely think is necessary. And, it really gives me freedom to fill the gaps that I'm seeing. That was my really main goal, and to be able to find my passions and follow those. So.
Love it. Thank you. Ruthlan, then Leah.
Oh, rapid fire, independence, autonomy,
Yeah.
challenging myself, which is something I absolutely embrace and love to do. Personal and professional growth, which of course challenging is personal growth, and using my years of experience and learning a new specialty was professional growth. Overcoming my fears, the whole cold calling thing, that once I nipped that, I was like, yeah, all right, I can do this. And just pursuing a passion. My personal motto is live life with passion. So, just pursue your passions, whatever they are. And as I had told Antoinette when I was mentoring her early in her entrepreneurship career, whatever you're passionate about, even if you get not feedback, not blowback, but resistance to what it is that you're trying to do and that you feel passionate about. If you are finding people not opening up to what you need to do, then find where you can put your business. Don't ever give up on what your passion is. That's it.
Thank you. Leah, then Anthony.
For me, when you sign up to be an entrepreneur, it's not just business growth, but it's personal growth. You become a different person when you own your business. You have to gain confidence. You have to learn how to advocate for yourself, be steadfast in the things that you value and you believe in. And, for me, at least, I found it very hard in the beginning to say no to things like Antoinette was mentioning. And it's essential to be able to do that and to be firm yet professional when having those difficult conversations, either with people, with businesses, and just kind of lean into that growth, which is uncomfortable but necessary.
I would say that nursing entrepreneurship is just really the power to make a global impact, or as big of an impact as you want. I think the power of going and doing entrepreneurship is that, obviously in bedside nursing, you make such an impact. And I think sometimes it is hard I know for me, that's something I'm kind of grappling with now, is going full-time with Lumify, just with our traction. But I think one thing that always excites me is just the impact that it can have, not just for a patient in the hospital, but for patients across the world. So I think it's really just an exciting way to create really broad impact and make healthcare better.
Awesome, thank you. Antoinette, get to close this out.
Yeah, entrepreneurship, especially in nursing, I think it's at the end of the day, my tagline is so that you can truly dare to be influentially visionary. It's to be able to allow my visionary insight and just what I've been equipped to do to inspire others. I think the role of entrepreneurship gives you space to motivate people in a way that maybe you never got a chance to, just because you often can feel limited by your surroundings or by your circumstances or where you think you should be going, or even just the expectations I think we place on ourselves. So it definitely, as many people said, it gives you kind of this leverage of freedom. But I think for myself, because I like to see such the broader picture of thing and kind of inspire not only my own vision, but the vision in other people, it just gives me space to do that, to allow people to be visionary, to have a broader outlook and perspective. And like Anthony said, just to be able to make that bigger global impact. And maybe your vision is not, to change the entire world, but just even being able to change your family sphere, your community sphere, the nation, the region that you're in, that in itself, that really, that speaks volumes. It speaks volumes to what we are equipped to do as people and how we are built to help one another. So I think especially in times like this, now more than ever, it's worth people knowing what your vision is so that you can make the biggest impact that you're equipped to make.
Bravo. That was a great way to end. So thank you all so much. We just scratched the surface. I think we'll be doing this again really soon. It was great to have you all. And I know that there's so many more nurse entrepreneurs out there. We have to bring them into the fold, and we'll keep having these conversations. So have a wonderful night. Thanks for taking time to be with us. And I hope you are well. We'll follow up in email. Take care.
Thank
Bye-bye.
you, Monica. Thank you, everyone. Good luck to everyone.
Oh, thank you.